We here at Reimbursement RX are being asked a lot about our view on MACRA and how it's going to impact physician work and physician compensation. This is still fairly new and largely unknown, but after reviewing pages and pages of MACRA documents, we can make two statements with utmost confidence. Number one, it's going to be very tough because our federal government just added a lot more things for us to do that have nothing to do with patient care. And number two, this unfortunately becomes a necessary evil. And if you want to get paid for Medicare and other carriers, you have to know what MACRA is and how to navigate it. Because MACRA is and will become the single most important phenomenon in how doctors in this country are getting paid. None of us will like it, but we need to learn. So what is MACRA? Well, it's the new law that was signed into law in April of 2015, and it stands for Medicare Access and CHIP Reauthorization Act. And CHIP, of course, is Children's Health Insurance Program. It replaces the current Medicare reimbursement schedule with a new pay-for-performance program that is focused on quality, value, and accountability. Well, this is where the confusion sets in. You see, we're all used to getting paid on a fee-for-service system. See the patient, bill for visit, or service, and then you get paid for it. Well, this is going to go away. A lot of emphasis is going to be placed on not just plain patient visits, but what it is that you do to patient and how your patients do afterwards. Basically, clinical outcomes. MACRA combines parts of previous quality programs that you're probably all familiar with, such as PQRS, value-based payment modifier, and meaningful use through your electronic health record. And all these programs are combined into one called MIPS, which stands for Merit-Based Incentive Payment System. Are you tired of those acronyms yet? I hear you. There's another one for you, APM. APM stands for Alternative Payment Model, where you get bonuses if you participate in shared risk programs such as ACOs, Accountable Care Organization, or various other programs. Now, APM will not affect as many physicians as MIPS will in the beginning, so we're just going to focus on MIPS. So under these programs, you will be scored so that you may receive a payment bonus or payment penalty or no payment adjustment. How do you get scored? Well, it's based on 4 main performance categories. Quality, which is tied to 50% of the score. Meaningful use of certified electronic health record, tied to 25% of the score. 15% of the score is tied to the third category known as clinical practice improvement activities, and finally 10% is the resource use. And the MIPS score can significantly impact your Medicare reimbursement, going from downward adjustment of 9% to whooping 27% plus by year 2022. Now, what does this all mean? How are you actually going to be scored, and what is it that you have to do? Well, the good news is that if you already use a certified electronic health record, keep doing so. Most of your EHRs have systems that are already built in and that capture things that you're already doing. For instance, most of your electronic health records will keep track of A1Cs for your diabetic patients, albuterol inhalers for your asthmatics, and ACE inhibitors for your CHF patients. This is just the tip of the iceberg, of course. Medicare wants you to have a secure clinical practice with policies and procedures in place. So make sure you have that and make sure that you're in compliance. Talk to your EHR vendor and ask them if they can help. Medicare hired a number of independent companies that are out there to help you with MIPS reporting and scoring. So what's the kicker? Why are we talking about it? Well, remember, this program is budget neutral. Remember we said some docs will get paid more and some less? Right. Medicare is going to distribute the same amount of money each year, and some docs will get less and some more. In essence, you're competing with one another. You will still get fee for service that you're getting right now, except it's going to be less what it is right now. For instance, let's say you get $100 right now for a certain service. A year or two from now, it's going to be $80. And now let's say you participate in MIPS and you do well in your scoring and your friend does not. So what's going to happen? Well, you get your $80 plus you're going to get a bonus that's going to take you hopefully over that $100 that you're getting right now. But what's going to happen to your friend? Well, she'll be stuck at $80. You see, budget neutral and very doctor friendly, right? So what can you do? What can we do? Well, we can walk out tomorrow and say we don't like a program like that. We don't want to compete with each other. We just want to take care of patients. A massive walkout is highly unlikely to happen. But we all understand how the system works, and we can work it, and we need to work with it. Now, what if we all do well? What if every single doctor complies, and does an excellent job. See, the system is based on failure. The system underscores the fact that someone needs to screw up, right? Because remember, it's budget neutral, somebody has to screw up on the MIPS. But what if no one does? It's just food for thought. We hope you enjoyed the video. Reimbursement RX was founded to educate residents and practicing physicians on how to navigate the business of medicine from the doctor's side. To stay up to date with our latest insights, please like Reimbursement RX on Facebook, subscribe to Reimbursement RX on YouTube, and check us out online at reimbursementrx.org. Thank you for watching.